Hello, I'm Les Bennett, and I have the pleasure of being the host and the interviewer for this series of Distinguished Scientists videos sponsored by the American Association of Pharmaceutical Scientists. The idea behind the series of videos is to provide an opportunity for others in the field and to provide a record of information and insight into the outstanding scientists who have made the pharmaceutical sciences an important part of what goes on in medicine and drug delivery and the aspects of health in the world. And so we are pleased to have with us today Professor William Elmquist. Excuse me, Bill, for saying that.
Yeah.
Bill is the director of the Center of Brain Barrier Research at the University of Minnesota and just stepped down as the chairman of the Department of Pharmaceutics after a 6-year period. So, Bill, great to have you here.
Oh, thank you very much. It's my pleasure.
So let's start back. You're from this area, apparently, or at least the state.
I'm from Florida, yes.
Yeah,
that's right.
and I know that you got your first degree in zoology.
Zoology.
So tell us what you were thinking, what you were doing, and then I know you went on to pharmacy.
Yeah,
so
well, I started out in zoology at the University of South Florida, Tampa, and was studying bird behavior.
Oh.
Yeah, kind of interesting. And then moved on to, when I graduated, I had an opportunity of either counting herons in the Everglades or being a technician in pharmacology at the University of Florida. I chose the technician in pharmacology. I always knew that I would end up as an academic scientist, and my career then started to move more into the laboratory-based studies. In short order, I went from a technician in pharmacology to going to pharmacy school at the University of Florida.
Great. Yeah, and then you went on after that and got a PharmD, right?
PharmD at University of Minnesota, and then following that did a pharmacokinetic fellowship in the Twin Cities in the kidney disease program. And then after that decided it wasn't quite as basic science as I was looking for, so I went into pharmacokinetics to get my PhD with Ron Sawchuk at the University of Minnesota.
Right. And then following that, I know you became a faculty member at Nebraska, but what about in between?
In between, Les, you and I share something in common. I was a faculty member at Washington State University for 2 years, as you were for a while in early career. And at that time, I started to study the use of microdialysis for drug protein binding, and looking at a very difficult drug at that time, cyclosporin A, for protein binding. And after we finished up, we spent 2 years at Washington State University in Pullman, and then I moved to the University of Nebraska Medical Center. I really needed a little more medical
background or support.
Well, support, exactly. Medical support with the research. And at the University of Nebraska, then we started to really hone in on the blood-brain barrier and how that limits important drug delivery for such diseases. At that time, we were studying neuro-AIDS. And so we knew that the virus would be able to hide out because of this unique characteristic. When you treat AIDS then with very effective drugs, we were able to suppress the viral load in the blood essentially to non-detectable. But as soon as you took those drugs off the patient, withdrew the drugs or discontinued the drugs, then the virus came right back. So it had to be still in the body, and it was hiding out at a sanctuary site. We felt that sanctuary site could be the brain. So we started to study how these particular drugs, protease inhibitors, nucleoside analogs, how they are limited in their blood-brain barrier transport, and in particular how efflux transport proteins like P-glycoprotein at that time limit